After 2 days of reporting fewer than 5,000 new coronavirus cases in Wisconsin, the crisis sees another spike with a new record in cases. Health officials report more than 7,000 confirmed cases, bringing the total since March to 278,000. Wisconsin is also seeing a record number of deaths, 66 total, and 2,300 since the pandemic began. Hospitals are struggling to deal with an influx of patients, more than 2,000 statewide. Healthcare systems have been hoping to avoid but bracing for these pressures for weeks.
In Madison, hospitals are taking in more patients from other parts of the state as they try to keep up. Jennifer Cleasy has you covered on how the systems are working to keep hospitals staffed.
We've been doing this for a while.
Patients with COVID-19 have been cared for at Meriter Hospital every day since March 17th.
For the past 9 days, we've had 50 plus COVID patients every day. We have doubled or tripled the number of COVID patients just since the beginning of October.
Emergency Preparedness Manager Nathan Bubenzer says because of that surge in patients, the hospital has had to reschedule surgeries, hire more nurses, and shift staff around to keep the hospital running.
All of those sort of fold together into one giant staffing concern. People are getting tired.
The same issues a block away at St. Mary's Hospital. Regional President Damon Boatwright says SSM is contracting out for nurses and pulling from other locations in the system to cover shifts.
We're taking all hands on deck approach to try to find any and all qualified but available workers who can help assist us right here in Wisconsin.
We've already kind of gone down our contingency plan.
After exhausting its similar options, Dr. Jeff Potoff says UW Hospital has formed a work group to figure out what's next as patients keep coming in.
A lot of it is offering up extra shifts. It's asking our staff, who we've already asked way too much of, to do more. And they're stepping up to that. That's probably not a sustainable plan.
The hospital systems are now considering outside help, the state's registry of 9,000 volunteer healthcare workers, or even federal disaster teams, to make sure they can keep up with patient needs.
But things look grim enough that we're starting to have these conversations to figure out, if we get into even a worse situation than we are right now.
In Madison, Jennifer Cleasy, 27 News.
We checked in with hospitals across southern Wisconsin, and regardless of location, most are in the same position, cautiously watching capacity and staff numbers. They're urging everyone to follow COVID precautions to avoid straining the hospital systems.